Just click that red button, guys. I've had a little bit of a problem remembering to click record, but we've got it now. Backs are our #1 body part that's injured. Probably most of us on this webinar today have had some sort of back injury in our lives. As a matter of fact, my son, 17 years old, in peak of health, walked in last night. Oh, Doug's pointing at his ears saying he can't hear.
No, you're fine now.
Okay. All right, is it working okay?
Yeah.
All right. We had a little bit of technical issues this morning on the first one, unfortunately. Sorry about that. If you can't hear us, let me know, and we'll pause for a minute. My 17-year-old son, young, picture of health, walked in last night. Oh, my back hurts. Mom, can you get me an appointment with the doctor? What'd you do? I don't know. My back just hurts. Doesn't matter what our age or our condition, we're all susceptible to a back injury. Now, if we're in better condition, we reduce our risk. But let's talk about that. Now, I'll just point out, though, backs have traditionally been the most costly injury that we've had. That's not the case anymore. I just want to point out that shoulder injuries are really driving the cost or the severity of the incidents that we have out there. But back injuries are really ubiquitous among any of us. We don't have to be a heavy laborer to have a back injury. We can be an office worker and simply bend over to pick up a box of paper or whatever it may be, and can have that back injury. Let's dive into why that is. Our body is a really amazing piece of machinery, the way it works, to transmit nerve impulses, to cause muscles to contract, pull on tendons and pull on bones, and move us around in a motion that allows us to do the tasks that we do. Pretty amazing what our body's able to do. So let's just talk about our spine for a minute, our backs. Our spine is a conglomeration of bones, muscles, ligaments, and nerves that all work together to really give us the structural rigidity that we need to be able to do our move around and do the things that we do. It's a pretty amazing thing. Our spinal cord transmits nerve impulses. Those nerves go out. If you look in here between the vertebrae, you'll have nerves come out in basically every vertebrae, and they service a different part of our body. When those nerves get impinged or impacted in one way, pressure or can actually be torn, those nerves will cause significant pain, even up to the point of paralysis. So if we sever our spinal cord or some of those nerves, it can paralyze parts of our body. In between the vertebrae, our vertebrae work as a joint to allow us to move and bend. Those in between those vertebrae are discs. Those discs serve as a shock absorber, a cushion between those bones to prevent bone on bone. If we get to that point, it's going to cause significant pain and also impinge on those nerves. And so that's why our spines, our backs are so important, and why they can be so painful. Because all those nerve impulses are going through that area. Okay, so what are our factors that might increase our risk of injury? And there's one that I didn't throw on here that I really should talk about, and that's smoking. I know smokers feel like they get picked on a lot, but here's some statistics that really might make you consider whether you keep smoking or not. There have been many studies that have been done that show our risk of back injury doubles if we're a smoker, if we use tobacco products. And why is that? The reason is those tobacco smoke causes our body to reduce blood flow to the extremities. That reduces the amount of oxygen that can get to our tissues and increases the likelihood that we're going to have an injury. So just that's a quick thing. You know, if you need one more reason to stop smoking, if you find yourself in that category, that might be the one. Is that it's not just back injuries, but all injuries, and it also makes it much more difficult for us to heal after we have an injury, because our body just isn't getting the blood flow that we need to to those parts of our body. Okay. Other things, just lack of fitness, and I find myself in that category. I'm working hard right now. I've got some trips planned, backpacking and such this summer, and so I set some goals. I had to set some goals to reduce my weight and get myself into better physical condition to be prepared to go on those long range hikes and things like that. And I'm happy to report I got on the scale today. I'm down 13 pounds. I've only got a lot more to go, but that is a risk factor to each of us, is just our weight and our physical fitness, how much activity we have. But even if you're in great physical shape, if we're not warmed up, if we're not ready to do the job, or if we do a dumb lift or we do a bad move, our backs are still at risk. One other risk factor that we have is our age. Even though my 17-year-old son tweaked his back this weekend, the older we get, the higher likelihood we have of having a back or other kind of strain injury, and it's harder to heal the older we are. However, young people wear out just the same as old people do, depending on the type of trauma that we put on our bodies. Let's just run through quickly the stages of injury. Most times, an injury like this happens over time, where we start out, we get a little bit fatigued, we have discomfort, pain, and then disability. It's a progressive type of injury. But with back injuries, it can be a traumatic one time, I reach to bend something and I twist at the same time, and it might literally go bang. Doug's heard of bang before, right? Shake your head, Doug. You can hear a bang happen sometimes, a pop, when this happens, and it's a traumatic injury that happens right now, and it's more than likely going to plague you for the rest of your life. So we don't want that to happen. Go ahead, Doug.
I can tell you that you can even hear a disc break.
I've had disc brakes before.
I've had
disc brake.
Not on your car.
Yeah. So Debbie says, or a big pop, tears in your eyes, and go to the knees on the ground. Yeah. Some have been in that situation. Some of us just have a nagging pain in our back that comes back to haunt us every once in a while. Now let's talk about how we hurt our backs and how our backs work. If you look at your spine in this picture, it has an S-curve, a natural S-curve. If we have proper posture, your back will be in a shape of an S. You think about that as you're sitting in your chair. Is it in a shape of an S, or am I hunched forward? Is it more in the shape of a C or another shape? That natural S-curve allows our body to bear a lot of weight, far better than if our spine were straight vertical. Those S-curves allow us to bear the weight of our body as well as other loads that we're carrying around. If we get outside of that S-curve, then we're not able to carry that, and it puts us at risk for injury. So so sit up in your natural S-curve and then hunch forward. That's my normal shape when I'm working on the computer. Hunch forward. What does it do? It puts weight on our spine. It causes a fulcrum point. All right, I'm good. It doesn't work very good on this. I need a fisheye lens on this camera. We'll do a quick demonstration. Uh-oh, I see a. Can you guys hear me? All right, I see a little spinning wheel.
Yeah, you're fine.
Hopefully everybody can hear me. This is a bowling ball with a handle on it. This bowling ball will represent your head and the weight of your head. If we stand with a normal S-curve, a good posture, that weight is directly over our shoulders, our head, and it puts it right onto our spine. that stress, they will, those muscles will get fatigued. After they become fatigued, they're more at risk for injury, because if our muscles can't hold that spine in place the way it's supposed to, things can slip, things can break. Okay. All right. So additional risk factors for hurting our backs are putting those backs under load. When we lift things, when we lift heavy things, when we twist while we're lifting. That's one of the worst things that we can do, is twisting at the spine when we're under load. Bending over, sitting and leaning are also risk factors for our backs. And then some people have a degenerative condition where their discs are just wearing out. They degenerate over time, and sometimes it can be a bone issue. So it's a genetic issue. If you find yourself in that category, you have to be hypersensitive and hyper careful to prevent this type of injury. Don't ever put yourself at risk by doing risky lifts, or even putting yourself out of normal position. You know, that standard S curve that we have. So, you know, everybody thinks, oh great, we're doing back safety today. People are they're just gonna tell us, you know, bend your knees and lift with your legs and that. I'm here to tell you there's no perfect or proper lifting technique. There are better techniques, but realizing that some people who have a back injury can't lift with proper technique. Not saying that you should do it with poor technique, but you physically have a hard time getting into some of these positions to do the lift. We'll talk about some basic principles of doing good lifts, but there's really no perfect proper technique. The other thing you need to know is you need to know your limits. Some people are physically capable of lifting more. Some people have physical conditions that preclude them from doing these things or put them at more risk. Doug says the best technique is not to lift at all. Yeah, that's been my goal in life, is to avoid all heavy lifting. Not necessarily. So why does this cause such an issue? Well, as we bend, there's a fulcrum point. It puts pressure on that vertebrae and the disc that is supporting it, and it is amplified by how far out we are. See this guy picking up a tire? If we reach way out to pick up that tire, and say the tire weighs about 100 pounds, with the weight of our body, that amplification equates to over 1,000 pounds of pressure being transmitted to our low back. That's why we have these back injuries. So watch that fulcrum point. So with that, we want to, one of those techniques is to keep the load as close to our body as we possibly can. Let's do a quick example here. I'm going to pick up a chair, not my desk chair. Let's pick up just a folding chair. You can do this wherever you are. How's the best way to hold a chair? If I hold this chair out here like this, I'm not going to be able to do that very long, and I put my back at risk. If I bring that chair in closer, you noticeably can feel, oh, I could do that a lot longer. So the closer to your body you can get, the better. So keep the weight close to your body. I can turn the chair like this, and it's even easier. If you look around the world, how people carry heavy loads, say they're carrying a container of water for a long distance, how do they carry it? They put that on top of their head. Now, I'm not telling you, we'll knock the light down, I'm not telling you to carry loads on top of your head. That's probably not a good plan, probably puts you at risk, particularly if you're not very good at that. But I am telling you how we minimize the risk to our back. Keep the load as close to your body as you possibly can. Avoid lifting definitely wherever we can. So keep that load close. Keep the natural S curves in your body. Your mom was right when she told you to sit up straight, keep your shoulders back, because that maintains the natural S curve. So think about that as you're lifting. How do I keep those S curves in my back? Because that's going to be best. Okay? Building a bridge. In this picture here, you can see this lady is building a bridge with her arm. She's lifting a heavy load, and that load would translate a lot of strain to her spine, low back, if she didn't have that hand down. So I was watching one of my neighbors had stopped to visit another neighbor over the weekend, and the neighbor had walked out and he was leaning down into the window of the other neighbor's car. And what did he do? He put his hands on the frame of the window. Why is that? Well, as we're bending over, we want to make a bridge. Is there a way that we can spread some of that strain from our back to our arms? Spread that weight out. So one way to think about building a bridge is if you're using a shovel. Sometimes you're in heavy sticky mud, or it's really heavy material. It's a hard lift. Can we bend down to the point where we can put our elbows on our knees and use that as the lever point, so it's not the fulcrum at our back? Let's build a bridge and spread that weight out. And the last thing we'll talk about on this slide is move with your feet first. So I pick up a load and I've got to turn and go to my left or right. Move your feet first. Don't twist with your back. That's a very risky behavior, is twisting. So move your feet. Start with your feet. Turn your body. Keep your back straight. Keep your S curve in your spine, and we'll avoid a lot of those injuries. All right. Maintain the power position. So as you picked up that chair and you're holding it out, if I hold that straight away, if I hold it above my head or way down low, that puts more strain on my body. There's this power position where I stand up with an S curve in my back, and I have my arms between 90 degrees out and below that. That's a good place to hold your load. That's where you're most efficient and most powerful in your ability to lift. Okay, let's talk about some physical habits and physical things that we need to work on to prevent these type of injuries. Number one, our fitness level. Like I said, I'm working on that. Not only working on losing weight, but working on my physical activity, so I'm better prepared for this. Many times, the reason why injuries happen is we're just not prepared for the lift that we have to do. We're out, we're driving in the truck, we just got to work, we haven't really gone out and done anything physical yet. Jump in the truck and we drive out, and here's a task we have to do. We have to lift a manhole lid or pick up a piece of equipment, put it in the back of the truck. We're not ready to do that task. How do I get ready to do work? Well, it comes down to blood flow. We talked about cigarette smoking and how that decreases our blood flow. Well, if we're inactive, if we're not having our heart going, we won't have the adequate perfusion of blood to our tissues. So get out of the truck and walk around. You can do some deep knee bends if you want. You can do stretching if you want. But really what you need to do is just get moving. Walk around, swing your arms, get blood flowing to your body. That raises our heart rate, gets blood flowing there, and it makes us much safer when we're actually performing the lift. Use proper tools. Use if we have a dolly to move a heavy load around, use that, a forklift, a pallet jack, those type of things. Use the proper tools for the job. Proper technique. Like we said, there's no perfect technique to do this, but if we can keep the load close to our body, if we can maintain our posture, all of those things will help. And then get help. If a load is beyond your ability to lift, get somebody to help. If you have a back injury, a pre-existing back injury, get some help to move that, or get somebody else to do that lift. Team lifting, if a heavy load. Now, team lifting can be risky as well, so make sure that you're communicating well with whoever your partner is in the team lift. So you say, okay, on 3 we're going to lift, and do a countdown and let people know which direction you're going, when you have to stop, or if you get to the point where you can't carry that load anymore, make sure that you're communicating that to your partner so they aren't surprised by your movement and cause an injury because you're trying to keep a hold of this load. Doug says I'm blushing. I think
Well, that was after you hit the light with the chair.
Oh, is that right? Okay.
Yeah.
It didn't break. Okay. Let's see. Oh, and one other thing that I didn't talk about was, let's see, was on moving patients around. So if you're in EMS or a healthcare situation, bodies are really awkward and they're heavy, and they put our backs at serious risk. This is one of the categories of workers where we have a lot of back injuries, are EMS, fire, and healthcare workers. So get help to move people around. Use the equipment. Many places have patient lifts, and use that equipment to move them around. And just from an EMS standpoint, don't be afraid to get additional help. Call in additional resources. You know, the common issue that we see is somebody collapses in their bathroom, and they've fallen back in between the tub and the toilet, and we've got to get that person out. It causes people to get themselves in a bad position, bend over, and that. Let's get help to get people out, and if we have to uninstall the toilet, so be it. Let's get that person moved without hurting our backs. Okay. And remember, posture. Your mom was right. Maintain that posture. And it doesn't matter where you're working. This is important. If I'm out working with a shovel or out on the road and I'm bent over all day long, my back's going to be sore and I'm at risk. Same thing goes if I'm sitting here in this office. If I'm hunched over my keyboard, by the end of the day, I'm going to be stiff and sore and in some pain. So maintain that posture. Sitting properly. This is something that many of us may not even think about. Is how do we sit? Whether we're in a vehicle or whether we're in an office, the way that we sit means a lot. Once again, think about what are those natural S-curves. Are we sitting on a weird angle? I don't know if you've ever had a problem with a wallet. How many of you take your wallet out out of your back pocket when you're driving? That's an easy technique that we can use to avoid some back pain, is to sit level and straight. And so think about that. Adjust your chair to a position that puts you in that power position, and so maintain the neutral position and the power position. Okay? There's more than one way to do a job, and think about how you can do this job without having to put yourself at risk. All right. Well, that kind of wraps up what I had to talk about. If you've got before I summarize, if you've got questions, type those into the Q&A box or the chat box, and we'll answer those. Just to summarize, take care of yourself. It's a great time to set a goal to work on your health, to stay adequately hydrated. I can't remember if I talked about that in this presentation. Lots of fluids, particularly water. You know, the soda doesn't do nearly as good a job of hydrating our tissues. If we're properly hydrated, our risk of injury goes way down. So take care of ourselves. Set a goal. If you've got a few pounds to lose, set a goal and do that. Increase your activity. When you go out to do a task, make sure that you're warmed up and ready to go. That doesn't mean you have to go out and do stretches or anything like that. That helps. But just get active. Don't be afraid to ask for help. Use the appropriate tools and techniques to help save our backs. All right, I'm just looking here. I don't see any questions there. Doug, Brent, do you have anything to share?
I would just add that it's important to remember also when you get fatigued, you're more susceptible to injury at that time too.
Yeah, absolutely, absolutely. So that lift that we could do at 10 o'clock in the morning might be the lift that will hurt us at 3 o'clock in the afternoon. So yeah, good point. Brent, anything?
That's all. Good job, Jason.
Okay. Thanks, folks. I appreciate your time, and go out and have a safe day. I went longer on that one.